You talked about transparency. When we see the waiting list figures published, currently it's about 7.2 million, they don't include waiting lists for mental health treatment, do they? Which are separate and probably now running at about 1.6 million. Do you not think that in the interests of transparency, parity of esteem, focus, that it would make sense to publish all treatment waiting lists for both mental and physical health together?
I think it's a very fair challenge, and I think it's one we can look at. I think one of the, going back to the New Labour period, I think one of the challenges is always thinking about the risk around targets. To what extent do they drive the right behaviours, or to coin a phrase from that time, people hit a target and miss the point. And sometimes how we ensure there isn't gaming of targets as well. So I, as I say, one of the, I think, challenges for all as politicians is consistency. And I've been very clear, I want fewer targets and more discretion for ICSs. I think how we empower ICSs, so rather than lots of central targets, I want to empower ICSs much more. So I'm naturally cautious around new targets. But I think how we bring transparency to the mental health weight is a fair issue that we are doing some work on.
With respect, I wasn't arguing for targets. I was simply arguing about focus. And inevitably, if the waiting lists numbers that are published are simply about physical health, and inevitably actions flow out of those, and focus is driven by those. I'm not arguing about targets, but you do accept then, and that's helpful, that we should be looking at publishing the mental health waiting lists alongside and as part of the general treatment waiting lists.
Well, I think we should, I'm very happy to take it away and look at what is the right level of transparency in what areas. I think it's not simply a question of that, though. I think it's looking at what is the additional funding that's going in, how we make it easier for people to access the treatment, what are the additional facilities that we're providing for mental health, and in particular, what more can we do on the prevention side before they get into the point of waiting. And that's where, for example, things like the schools programme is making progress in terms of making sure that schools have a mental health lead, the support in more than a third of schools now in terms of mental health support teams as a specific programme. So there's a range of things within the mental health space.
Absolutely. And Secretary, so just going back to the point about what behaviours can be driven, unfortunately, by applying more and more differentiation within the targets. I think, exactly as you say, we have to be quite thoughtful about, particularly in the context of the HEAT review and the decisions that have been made, and the Secretary of State has been very clear on, in terms of being really, really focused on what people are delivering. It's really important that we think those sorts of things through, so very happy to take it away.
Thank you very much indeed, Chair. And we thought we'd open part two talking again about the opening issues in part one, which was around the industrial action. I mean, you said, Secretary of State, the context for that in looking at all of the other pressures that are facing staff, and clearly it's having an impact on morale. I guess you could also look at it in the context of 13 years of pay constraint, which has just found a tipping point with levels of inflation at the moment. So there is clearly a real issue there for pay. But I wanted to explore the point you made about flexibility with junior doctors, if I could. Because you're right, certainly talking to junior doctors in Sheffield, it's not just about pay. Pay is hugely important. But I think you said you were prepared to talk about things like exam costs, because clearly those are quite important, for junior doctors in their early years. And there probably aren't very many other professions comparable where the employer doesn't pick up costs of required qualifications for sitting exams for required qualifications. So you are prepared to talk about that, are you?
Well, the Junior Doctors Committee itself suggested a number of things, and that was one of the areas that they highlighted. They talked about exam fees, GM GMC fees, they raise parking, they raise flexible pay premia, and so forth. The point, Mr Blunsfield, I was trying to highlight before was, as with the discussion with the NHS Staff Council, there was a range of issues that were raised with us, and our agreement with the NHS Staff Council reflected that. So yes, pay was an important part, so was the lump sum, and so was the commitment to work on a number of other areas. So there were three elements to the deal, and as part of our discussions, I thought there was merit with the junior doctors in having a conversation that looked at the workforce pressures they face in the round, and that could include, for example, where the rostering means that they're having to move around a lot. One of the specific issues a number of junior doctors raised with me was often having to cancel their holiday at the last minute, and they've booked annual leave, and then suddenly they're asked to make changes at very short notice. So the point in terms of bringing in an intermediary at their request through the role of Cathy McLean was to say, yes, let's have a discussion of pay, let's have a discussion around any potential non-consolidated or additional amount, and let's have a conversation in terms of the other factors that shape morale. And that's what we were open to discussing, but in calling the strikes, they took a decision to collapse those talks.
So just to be clear, and I take the point about rostering and all of those other issues, which must be difficult, but you are prepared to open a discussion about the non-pay financial pressures that junior doctors face. So not only the initial professional exams, but continual professional development costs. You're up for a discussion about supporting them with those issues.
Well, the junior doctors said there were a number of issues of concern to them.
No, they did.
We were open to discussing those. Obviously, there is then a question within government: to what extent do they come off, in essence, the headline pay award, and so what is used for the pay award and what is used for additional elements, and that's part of the wider negotiation. The point I was signalling was we were open to continuing discussions. It was the Junior Doctors Committee leaders that chose to collapse those talks and did so before we'd had as full a discussion as I thought we could.
Right, but you certainly recognise that there are a combination of financial pressures facing junior doctors as well as the corrosion of their pay value.
I think there's a number of factors
and indeed the level of graduate debt that they have, which is much larger than
I think there are a number of factors in terms of the, I would apply it more widely in terms of the NHS estate, and that's why we've committed to the biggest ever investment in the NHS estate, over £20 billion in the new hospitals programme. Tech is often raised when I go on visits, and I'm sure when you're talking with medics in the constituency, that is often a bugbear of those on the front line, and that's why I signalled in the NHS Confederation speech how much I was keen to prioritise the investment in tech. The numbers overall of staff is a factor as well. That's why we've got the long-term workforce plan, and of course pay is an element too. So the point being, there's a range of issues that feed into morale. We're keen to discuss those in the round, and it was regrettable that the Junior Doctors Committee chose not to.
Okay, I wonder if I could move on to one of the issues in relation to nurses and their settlement. You'll know that the questions have been raised about why NHS bank staff haven't had the one-off pay settlement, which was part of the deal for NHS staff more widely. And I think I heard you quoted yesterday as saying this was always the intention. It wasn't something that happened by accident. How do you justify not paying NHS bank staff the one-off supplement that was important for others?
Well, I must slightly, if I may, respectfully take issue with your assertion it was always part of the deal. Quite the opposite, in fact. So the discussion with NHS Staff Council was always on the basis of those staff within the Agenda for Change employment terms. Now, many bank staff will, of course, be covered by that, in terms of a significant proportion of their contribution to the NHS, and may do some bank in addition to that. But it was always clear in the eligibility criteria we discussed pre-negotiation, that was communicated to trade unions, again during the negotiations, and that was always the basis on which we negotiated with the Staff Council. So it wasn't part of the deal and there's change. It was actually always communicated to the NHS Staff Council.
Perhaps I wasn't clear on my question. I think I was probably paraphrasing something I thought you'd said yesterday, which kind of is absolutely in line with what you've just said, that it was never the intention to pay bank staff the one-off component of the deal. My question was, in what way do you think that's fair or reasonable, which is how you've described the settlement overall?
Well, many of those who are doing as in terms of bank will be also working within the agenda for change and will be covered. If what you're really alluding to is less bank and more things like social enterprises, and so in essence the wider scope of the AFC deal, then those services will be uplifted through their usual funding routes. And again, that has always been the case, with the exception of 1 year. I think it was 2018, which was the exception when a different approach was taken. But in all other years, that has been the way the negotiation has been done.
So you're not saying that all bank staff, for example, in NH professionals, actually receive the one-off payment, are you?
No.
No, just to be clear. I mean, do you not think that there's a risk that bank workers might opt to leave that form of employment and become agency workers where there'd be greater costs for the NHS?
Well, as agency workers, they wouldn't qualify. So I don't think that would be the driver of moving to agency. So the point being, consistent, as I say, there was 1 year that was an exception in 2018, but consistent with past years and consistent with the discussions we had from the outset with the NHS Staff Council. The discussion was in the context of a 5% pay award plus a lump sum. That's what we agreed with Staff Council. That is what Staff Council then put to their members.
Yeah, I understand the mechanics of what happened. My question was in what way you thought that was fair and reasonable for people who are kind of working alongside each other, but in one different category, not to get that one-off payment, which you thought was an important component of the deal.
Well, because those, as I say, as per past years, those services are funded through a normal commissioning model, and that has been the way those services have been funded in the past.
Okay. Yeah. Can I move on to a different issue, but still a workforce issue, which you talked about apprenticeships earlier. And I just wanted to raise with you problems that the apprenticeship levy presents for NHS employers, and this is based on discussions that I had with the local Teaching Hospitals Trust in Sheffield. Now I know there are general issues with the apprenticeship levy, which we all appreciate, but clearly the NHS isn't a normal labour market, which kind of makes the rules governing the apprenticeship levy particularly unsuitable. I mean, in fact, it can only be used to pay training providers for the cost of the training and assessment. It can't be used to pay apprentices' salaries. It can't backfill. It doesn't cover procurement costs. The result of that, I'm told by my local hospital trust, is that they are returning half of the money that they receive back through as a consequence of paying the apprenticeship levy. So they get 3.5 million annually. Half of that is returned to HMRC. So it's money seeping out of the NHS. I wonder what assessment you've made overall of the money returned to HMRC through NHS providers.
So certainly looking at nationally, because this is something the Secretary of State for Department of Education has spoken to, I know nationally pretty much all the apprenticeship levy is now being spent. Now, what is sometimes lost in some of the figures is where a particular organisation doesn't spend all of its levy, that is then often used in terms of SMEs, because SMEs get further support. They pay, I think, 5% of the cost, and the additional is paid. And organisations can also spend unallocated levy within their supply chain as well. So there are, when I was in the department 5-6 years ago, one of the key issues raised with me at the time, and indeed I went and spoke to the Department of Education Skills Minister at that time about this, was the amount of levy that was being returned. And part of the challenge then was there was too much variation across the NHS. In fact, near to your constituency, Mr Bloomfield, certainly 5-6 years ago, Leeds was an exemplar as a hospital that's spending all of its levy, and it may be that Sheffield is still not, but other hospitals in the region or other trusts in the region are. I'm very happy to look at any specific issues in terms of if it's Sheffield that you're referring to in terms of their use of the levy, but one of the changes that we discussed some years ago, and I know where there has been flexibility, is in allowing employers more flexibility in terms of the supply chain or how that is spent elsewhere. But if there's a particular issue with Sheffield, very happy to look at it, but I know other trusts are spending their full levy, and one of the things I'd be very keen on is to understand at a time when skills are so important to staff, and again, you know, if I just look at the round table with nurses yesterday, one of the key things they were talking to me about was how in certain trusts they'd worked in, there'd been huge support for continual professional development, and in other trusts they worked in, they didn't feel that support was there. So I'd be very keen to understand, are there any particular issues locally that are getting in the way which are not the case elsewhere?
I'm imagining that the sort of, and I recognise there'll be variations, but I'm imagining the sort of challenges that are presented would be fairly similar with other teaching trusts, which is why I asked if you'd made an assessment of how much money across the system is returned by NHS providers to HMRC, because I'd be surprised if you hadn't.
Well, I haven't got any reason. As I say, 5-6 years ago, I spent some time on that specific issue when I was last in the department. I had a very recent discussion with the Secretary of State for Education around the levy more generally, because increasing skills is also extremely important to productivity. It's assessments that it could be 30% across the economy as a whole in terms of the addition skills can make in terms of productivity gains. So there is a real push in terms of vocational and apprenticeship levy training. That is a big part of the long-term workforce plan and the thinking there. So the direction of travel that you're identifying is one we absolutely support. Very keen to understand if there's some local variation, and we can look at that.